Breast Cancer Awareness Month is very important because breast cancer is the most commonly diagnosed cancer in women, and it's the second most leading cause of cancer death in women.
Dr. Richard Greco Jr. is an obstetrician and gynecologist at Lehigh Valley Health Network in Hazleton. His message comes during October, which is National Breast Cancer Awareness Month, but the information is important all year round.
There's currently 3.5 million women who are diagnosed with breast cancer currently in the United States. The breast cancer survival rate, the 5-year survival rate now is about 90%, whereas in 1975 it was about 75%. So we're definitely making a dent, in the numbers.
Early detection is key, and Breast Cancer Awareness Month is an important reminder.
We like to have them come back in these yearly visits so that we can check to see if anything is growing. By bringing this up to the public, it helps us to make them aware again. They may say, oh, whoops, I forgot to schedule mine for this year, so I better go back.
Dr. William Harder Jr., a radiologist with Lehigh Valley Health Network, explains how technology has improved the process.
About 50 years ago, they discovered that rather than just take a picture of the breast, just put it up against something and take your x-ray, sort of like you do for your chest x-ray annually, you just stand up against, there it is, that if you compress the breast, it would give it a better detail and you can find smaller things, and it also allows you to do lower dose, which is a big concern these days for any of the x-rays that we're doing. And that was probably about 50 years ago. Dr. Egan did that. And since that time, we've gone through different phases of, should we print it on paper? Does it show better? We used to print it on plastic with silver. And then, of course, we began modernizing about 20 years ago and went to digital mammography. And now we're digital and actually three-dimensional.
This is the 3D mammography machine that Dr. Harder referred to. While it may look like your typical mammography machine, the images it produces are anything but.
We can get much more detail out of any of the images we have because we can actually manipulate on the computers to help us with those issues.
I'm here in the room now where the mammography machine is, and I'm with Mary Jo Plebin. Mary Jo, what is your job here at the Wellness Center?
I'm the radiology manager here at the Wellness Center, and I'm also a mammographer.
Now, if I was your patient that just came through the door, talk to me like you would in a real scenario.
All right, I would bring you into the room. I would get you in position for the first view. I would explain to you about the compression. Compression is one of the most important parts of a mammography study. Basically, the more I compress the breast, the more detail we're able to see, and also the lower the radiation exposure to you. Once I get you in position and can do the compression, I will tell you to hold your breath. You'll see the tube up above arc from left to right. That's when the X-ray machine is taking the images. What that does then is the computer then formulates those images into 1 millimeter slices so that we're seeing from skin surface to skin surface 1 millimeter at a time throughout the breast.
I just pulled up this example off my computer online, but we would be looking here and looking to see if there's any asymmetry there. Is there a mass? Is there some area that's darker or lighter than another? And what we can find, we would also be looking for clusters of calcifications which can show up either in benign or malignant situations.
And while the process has improved, there are other factors to consider.
So whenever I see women in the office, I do ask them about their family history, because family history is very important with possibly finding risk factors for breast cancer. The most common genetics that we have are the BRCA testing, BRCA1 and BRCA2. It's been shown to be associated with breast cancer, 60 to 75% lifetime risk, of developing breast cancer. And one of the more popular actresses who had the BRCA gene was Angelina Jolie. So, I try to ask anybody who has very close family members who are diagnosed with breast cancer, whether either mother, several maternal aunts, their sister, I'm trying to see if I can get any type of risk factor to screen these patients, for genetic risk factors.
A lot of people probably do say, well, there is no history in my family, therefore why do I need it? What do you say to that?
Well, I think with your family practitioner now, you don't know. I mean, they weren't tested. I mean, they may be one of the lucky ones that never grew, or perhaps they passed away before it showed up, and it was there anyway. So they'll probably ask you to get the test for genetic markers at least to see what your baseline is.
The importance that you're dealing with now is what's known as self-breast awareness. And self-breast awareness is pretty much women being attuned, to their own bodies. I mean, nobody knows your body better than yourself. I mean, you're dealing with it every day. You'll notice any type of changes, that are happening. So really, we just tell women to be aware, of their breasts. Like when they're in the shower, doing things in particular, you're just looking for any change, in the contour or anything else, with their breasts. But the important thing regarding the exams is it should be done by a physician. And with regards to the breast exams, starting at age 25, it should be done every 1 to 3 years between ages 25 and 39. And then starting at age 40, it should be done every year by a physician.
So whether it is the month of October or any month of the year, the bottom line is
the earlier we can catch it, the more earlier it can be treated in a more conservative manner.
Reporting for SSPTV News, I'm Lisa Sugart.